When planning your retirement, there's a lot to think about. From how much you need to save, when should you start taking Social Security, and what are you going to do with all your free time? Yet, all too often, retirees are surprised by one major expense they did not account for: healthcare. Today, we know that healthcare can be a major expense for retirees. In fact, the three largest expenses you will face in retirement are housing, transportation, and healthcare. So making sure you have planned for it is important. Why does it catch so many off guard? For starters, many assume that Medicare will cover all their healthcare costs. And while Medicare does provide for healthcare coverage in retirement, it does not cover everything. Premiums, deductibles, co-pays, co-insurance are just some of the costs you will be responsible for. Furthermore, if you want coverage for prescription drugs, vision, and dental services, you will be required to purchase additional coverage. And don't forget, Medicare doesn't cover stays longer than 90 days in a skilled nursing facility. So how much can you expect to spend on healthcare? The amount you spend on healthcare will generally increase as you age. Today, a healthy 65-year-old couple will spend about $12,052 a year in out-of-pocket healthcare expenses. At 75, that will increase to $21,706. And by age 85, it will jump $37,839. That is over 3 times what they spend at age 65. Why a jump? Imagine your retirement as having 3 distinct phases. The first phase is what we call your go-go years. During this time, you are living life to the fullest. You are traveling, playing golf, spending time with your family and friends, doing all the things you look forward to doing in retirement. During this phase, you tend to be healthy and living independently. But as you age, you will enter the second phase of retirement called the slow-go years. While you still might be able to do all of the things you were doing before, now it takes a little more energy to do them. Driving might become a little more difficult. You are moving a little slower. Those aches and pains start to act up a little more, requiring a few more doctor visits than before. Finally, the third phase are the no-go years. During this time, you may no longer be able to live independently. Things such as cleaning your house and grocery shopping may require you to hire someone to help, or you may need the support from a nurse or family member. It is during this phase when healthcare costs really go up. Your financial professional has products and strategies to help you plan for these costs, such as insurance products commonly referred to as linked benefit products. These products combine life insurance with long-term care benefits, allowing you to access benefits to pay for services such as skilled nursing, in-home care, and medical services. Additionally, there are other insurance products, such as a fixed index annuity, that can increase the income you receive should you no longer be able to care for yourself. Then there are Medigap policies that can cover some of the expenses that Medicare does not.
Thank you for watching this short animated video on healthcare. I'm Joe Zingone, the Realistic Economist. What we're going to look at is healthcare will become one of the 3 major expenses that we face in retirement. Because it's so much confusion and it's very varied, many folks are going to be getting caught off guard. Medicare, just to give you an example, has been around since 1965. It has 4 different parts: Part A, Part B, Part C, and Part D. Now, that's a lot of confusion, including with the Medicare supplement plans that also use letters A, B, C, and D, E, and I think it goes on for about 12 or 13 different alphabet letters. What you look at additionally is Part C of the regular Medicare is actually an entirely different plan, very different from Parts A, B, and D. So it becomes, unfortunately, somewhat confusing. What we want to do is just to give you a little quick example of Medicare and nursing homes and what the difference is between custodial care and rehabilitative care. You know, custodial care is basically you really can't take care of yourself well anymore, in contrast to rehabilitative care, when that is something that you're going to like a replaced hip or a knee, it's going to kind of get you back to where you were before you can take care of yourself. When we look at the go-go years, the slow-go years, and the no-go years, what we're going to see as we go into the slow-go and the no-go years, our healthcare costs become a little bit more escalated, get a little bit more costly. Unfortunately, we don't get into better health as we get older. Now, there are many different options to help keep your costs down, which is important, and provide additional benefits. Linked benefits is one such idea, as referred lightly into the video. What you need to do is understand that these items have to be in place before they're needed. You know, many folks over the years have said to me, Joe, Mom, or Dad needs some help with something. And we look at it and say, I wish I can help, but what you needed to do was to take care of these things, unfortunately, years ago. Now it's a little bit too late. What I like to do is to give you some options and some benefits, explain, answer your questions. I'll gladly do that either on the video or on this little part here. If you email your questions to joe@realisticeconomist.us. Again, that's joe@realisticeconomist.us. And I'll be glad to answer your questions and get back to you quickly as soon as I can. Thank you very much.